Good morning, all. I'm very happy to welcome you all on this first Sunday of this new year. Happy New Year to all. Okay, so let me immediately start the screen sharing. Okay. So good morning, all. I'm Dr. Divya, extending my warm welcome on behalf of DK Academy. Happy New Year and wishing all our dreams come true in this new year. First, thank you all for accepting my invite and giving your valuable time for this orientation session. A dream of MDS has connected you and me, and I consider this as a great privilege. To stand beside a person with a dream is not just a responsibility, but a journey to be crafted with care and passion. We at DK Academy are blessed to share the journey with you in this new year. This is my favorite Tirukural, which I follow since my childhood. Efforts never fail. Whatever you sow, you are sure to reap it. And it has never failed, and it is my strongest belief. So, this Sunday morning, your first effort towards your goal will guide you in the right path. So, let us all join together in this journey. MDS, once even I thought that it was not my cup of tea. I had so much of doubts whether I can really get my MDS. And when I started my preparation, the doubts further increased. And in fact, even I felt so discouraged that I gave a break of few months. But then again, I started all over. And there came a day when I was able to get my MDS merit seat in AIPG. In retrospect, when I think, why did I doubt myself? What were the fears I had? And what made me stand up again and continue my journey? The answer to all these questions will be my guidance from DK Academy towards your journey of attaining MDS. So let's get it done together. Whatever seems impossible will become possible. Okay, so let's share the journey. So our target, INI-CET and the NEET MDS. So in INI-CET, which has all the reputed institutions of AIMS, JIPMER, and PGI, let's make sure we fall within the first 12 ranks. Okay. And for NEET MDS, it is the first 150 ranks, which is going to give you the government college clinical seats. And I want all of you to enter within the first 12 of INI-CET or with the NEET MDS within the 1 to 150. Okay. 150 to 400 will still be a government college seats, but non-clinical. Those who are really passionate about it, please go ahead with non-clinical, but see to that your rank is within the 150 so that you get a good college. So our target is this, and let's set our target towards these. So how are we going to help you? All of us have different methods of preparation. Some will want to read alone. Some will want a group discussion. Some likes pictorial representation. Some likes audio listening lessons. So there are different types of learning for different people. So at DK Academy, we try to deliver our classes in all possible formats, be it audio, video, offline, pictorial, analytical, group discussion, and one-to-one discussion. Because any method of preparation finally needs a discussing platform. Without discussion, we can't go ahead because all of us will have our doubts. So one way or the other, we will see to that nobody is left behind, and at the same time, we will be traveling, aiming our goals higher. Okay, so this is where DK Academy is going to come into play. So here, this webinar, I had just planned a small topic to show you how our classes will be making complex things simple. Okay, so this is the facial nerve. When you see this image, we always think, how are we going to remember all these branches and the functions and all that? So let's start the decoding of the facial nerve. Okay. So facial nerve. So once you remember the facial nerve, remember the 7 yes. Okay. It is the 7th nerve. It is attached to the stem of the brain stem. It supplies all the derivatives of the second branchial arch. And what are the derivatives? The stapes, the superior part of hyoid, stylohyoid muscle, and the stapedius. So whenever you remember the facial nerve, you remember that it is the 7th nerve and it has 7 yes components. Okay. So from the brainstem, there are 4 nuclei which has the fibers for the facial nerve. Okay. So here you can see the motor nucleus, and then the superior salivatory and the lacrimatory are together. Okay. They work together. And then you have the nucleus tractus solitarius. Can you see this tract? So remember this nucleus tractus solitarius, NTS. It carries the fibers for the 9th nerve, 10th nerve, and the 7th nerve. Okay. It carries the gustatory sensation. So for facial nerve, it is going to be the anterior 2/3 and through the cauda tympani nerve. So these are the 4 nuclei in the brainstem. Okay, once it has come out of the brainstem, and how is that facial nerve going to go about? Okay, so it has a GPS map to travel. So remember these 3 landmarks: the geniculate ganglion, the pterygopalatine, and the submandibular. The 3 ganglions. Geniculate is always the genius, and it has all the 3 fibers, that is the motor fibers, the sensory fibers, and the gustatory fibers. Okay. But you can see the motor root branches separately from the geniculate ganglion. Okay. Then this part is the cauda tympani nerve. Okay. Cauda tympani nerve has 2 functions. One, it is sensory gustatory to the tongue, anterior 2/3 of the tongue. And then you have this secretomotor function, that is both to the submandibular and the sublingual gland. Okay. So both these are supplied by the submandibular ganglion. So the function of the facial nerve, you remember this GPS, 3 ganglions, geniculate, pterygopalatine, and submandibular. And geniculate has all the 3 fibers, whereas the P and S goes only with the parasympathetic function, that is the secretomotor function. So this is just a small exercise. So you can just to check out whether you can remember. Okay. So the 1 goes for the G, geniculate, and 3 goes for the pterygopalatine, and 2 goes for the submandibular. The 4th mark is the cauda tympani nerve. Okay. So to show that it has 2 functions. And this is the the geniculate ganglion part, which comes out from the brainstem. This slide is very important because the questions frequently come from this. Okay. So what is efferent? Efferent is always going to be motor, and efferent is always going to be sensory. So whether this efferent is special or general, and the afferent is whether special or general. Okay. And facial nerve has all the 4 components, that is the special efferent, general efferent, special afferent, and general afferent. The general, all are visceral functions. Okay. And the general afferent is a very minor component. It's just the sensory part to a small area behind the ear, the skin region. Okay. These 3 functions, the first 3 functions are very important. The muscles of facial expression are supplied by facial nerve, and that is considered the special efferent function of the facial nerve. The secretomotor you saw through the to the lacrimal gland and to the salivary glands. So that function is called the general efferent. And the special sensation is the taste. So it is the special afferent because it carries the sensation. So all these four functions, please do remember. And these are some of the frequently asked questions too. So now in this, just can you guess the pathways? So the 6 is going to be the secretomotor. So it will be the general visceral efferent, GVE. 5 is the special taste sensation. So it is going to be the special visceral afferent because it's sensation. And this part, the motor nucleus, motor root goes for the muscles of facial expression. So it is going to be the special visceral efferent. Okay. So this figure helps you to remember the functions along with the GPS. Okay. Though simple, but makes things easy. Now you know the GPS pathway, the functions. So lacrimal gland is supplied by which ganglion? So according to the figure, you know that it is the P part, that is the pterygopalatine, but you don't see the P here. Okay. So the answer is the pterygopalatine ganglion. Other name of pterygopalatine ganglion is sphenopalatine ganglion. So sphenopalatine ganglion is the answer. But when you're faced with such a question, how are you going to approach it? Okay. At least we should try to answer it by eliminating the other answers. Okay. Otic. We know that is something with the parotid gland and we have not read it in the facial nerve. Ciliary also with the ciliary muscles of the eyes. And submandibular ganglion, we know that it supplies only the sublingual and submandibular gland. It cannot touch the lacrimal gland. So the left out option is the sphenopalatine. Just remember that pterygopalatine, other name is sphenopalatine. So now with the branches of the facial nerve. So this one figure, you can remember all the branches of the facial nerve. Okay. So this small circle here is the stylomastoid foramen. And this divides the path into intracranial and extracranial. Okay. CNG gas is always inside the cylinder. So CNG is for the intracranial course. So what is CNG? Cauda tympani, nerve to stapedius, and the greater superficial petrosal nerve. So this is the branches intracranially. So for the extracranial, the acronym to remember is the speed terminal. So the speed terminal. So you know the terminal branches, no? You always keep those 5 fingers along the parotid gland area and say temporal, zygomatic, buccal, mandibular, and the cervical. And these 3 ones immediately at the exit of the stylomastoid foramen. Okay, immediately at the exit of the stylomastoid foramen, you can see the 3 branches. That is, this is the stylohyoid. No, we saw that it supplies the stylohyoid muscle, second branchial arch derivative. And D is for digastric. It supplies the posterior belly of digastric, not the anterior belly, because the anterior belly is supplied by the mandibular nerve. Then the one behind the ears, it is the posterior auricular nerve. Okay. So this is the acronym for the extracranial course, speed terminal. So when you see this, if you can remember this image, you can tell the different branches of the facial nerve. So this one, the stylomastoid foramen divides the course, intracranial, extracranial. Intracranial is CNG and extracranial is speed terminal. So among these 4 options, which is the branch of the facial nerve? Okay. So we know the G, the CNG, the greater superficial petrosal nerve is the branch of the facial nerve. All the muscles of the face, almost all the muscles are supplied by the facial nerve except one, that is elevator palpebrae superioris, which is supplied by the third nerve of the oculomotor, that is muscles of facial expression. All the muscles of facial expression are supplied by the facial nerve except the levator palpebrae superioris. Because muscles of mastication like this masseter and all those things, that is supplied by the mandibular nerve. And this always with facial nerve, we have this palsy question and element, that is a lower motor neuron lesion, is the same side entire half, ipsilateral. And for upper motor neuron, it is contralateral, opposite side, lower half. So what is this condition? It is ipsilateral. The entire side is affected. So it is lower motor neuron lesion. Okay. So this is how we have to approach a question. Okay. And this, I have a short planner how DK Academy is going to go about, how we have scheduled our classes. So our preparation is aiming towards keeping the things simple. Many of us have this habits of taking notes and notes and notes. Facial nerve, we'll be reading it for 3 days. And finally, at the end, we'll be still confused. So what to focus on? What is important? From which part the questions are going to come? We are going to concentrate only on those. So keep your things very simple. But you should be consistent. Our planner even has the thing like you have the daily mini test and a weekly test and also the monthly test. Don't get scared. Why so many tests? No, it's not that you have to get the full centum and full marks. Even a 50% will do. It is just the reminder. It is just making you remember the things again and again. So daily mini test will be just 5 simple questions. It's like just 5 simple things. In the end of a week, you will be having like 35 questions. So a small step each day makes your journey easier and also makes you travel your journey more confident. So we see to that you revise and revise so that all your facts are strong and with clarity. So it will be in 3 phases. The first phase, it will be all the subject-wise lectures will be conducted and side-by-side tests, all the daily and the weekly tests will also be conducted for the subject we are concentrating on. Suppose I'm taking anatomy, for the next 1 week, it will be the anatomy test, all the daily and weekly tests, and finally you will be having the mega test. So like that, we'll be covering all the basic and the clinical subjects. Okay. And in phase 2, we'll be having discussions and also mega test series, the real online test. And it will be focusing first on the INI CET. So I want you all to go fully prepared for the November 2024 INI CET. Okay. And the phase 3 will be for the NEET MDS 2025. So that will be from December 2024 to February 2025. So this is how the revisions will be. So the first itself, the subject wise itself, you will have many revisions within, the mini test, the weekly test, and the subject wise test. So you will be having almost 3 revisions within the first revision only. And then it is going to be the revision 2 mega test series for NESET and then the mega test series for NEET. Okay. We'll be even inviting guest lectures, that is AIMS candidates and All India candidates, to clear the controversial questions and how they approach their exams and all their knacks and tricks. And you can discuss with them, and we'll be calling them from different departments so that those subjects you will be able to clear the doubts also with them. Okay. So these are the different programs. So we have a 14 months offline and online classes and the test series. Okay. And then the 14 months exclusive test series. And the 3 months rapid test series is from Jan to March for those who are planning to appear for this NEET 2024. Okay. So these are our charges which can be done, payment can be done online. And our classes, the big day is starting on the 21st Jan. So I wish all of you register before that. Today is 7th, so you have 2 more weeks. So please register yourself. Don't miss out any classes. And please travel with us from the initial step so that we can build and give a very valuable service to you. Okay. So thanks for listening. The WhatsApp group and the number we have shared, please feel free to contact us. Okay. Thank you all once again for spending your valuable time with us on this Sunday morning. Happy New Year once again. Thank you.